Self as a Leader by Morgan Castle. At my current position as an RN, there are many influencing factors that help shape my leadership role as both an RN and as an NP. Throughout nursing, you have to be able to work together with your coworkers and with ancillary staff members in the department. In the ER, things are chaotic and forever changing. However, the job duties and responsibilities remain the same. These job duties and responsibilities are to stabilize the patient and move on to the next situation while still being able to maintain your previous patient. Determining your role in an emergent situation is part of being a leader. I have had multiple instances where I've had to step into the role as the leader for cardiac arrests, respiratory arrests, or other emergent situations. The people I have mentioned are all people who have influenced my ability to lead in situations where there has to be a leader present to keep things running cohesively. My influences are my manager, my preceptor, coworkers, job duties, and job responsibilities. Principles of leadership. As I continue to grow in leadership, I expect to continue to elicit traits that make me a good leader. My hope is that I can grow into a respected leader like my manager, charge nurses, and preceptor, where I have a good relationship with those that I lead. The personality trait that I exhibit the most is conscientiousness. This is when someone is organized, industrious, dependable, and disciplined. While working in the ER, the leadership traits that I exhibit the most are the coaching style traits. This is when someone is a high directive, high supportive leader. This is when the leader provides details on how to achieve goals, but also provides nurturing to the team members by giving and gaining input and providing constructive feedback as the work progresses. I consider my leadership style as individualized consideration as part of transformational leadership, as I try to provide personal support and constructive criticism to team members to help them reach their full potential to still meet the needs and the goals of the team. Self-evaluation. The National Organization of Nurse Practitioner Faculties, the NONPF, withholds the standards of the institution's missions that help guide education that improves quality assurance and improvement. This is helpful in guiding leadership because it allows for self-assessment and reflection, which is helpful in aiding leadership qualities because you're able to self-reflect on your own personal strengths and weaknesses. The American Hospital Association, the AHA, helps to influence nurse leaders by giving them a framework to help educate legislators and regulatory agencies about the impact of health policy on patient care, the workforce of nursing, and what communities they serve. This helps influence leadership by having people to support you during your decisions as an NP to help care for the community you serve as far as resources, job duties, and expectations. The Institute of Medicine, or the National Academy of Medicine, the IOM/NAM, has a large influence on medicine as it has an impact on policymakers and to the public. It helps aid in research agendas, advances in health equity, and has a supportive culture and continuous learning. This helps shape influence in the aspect of supporting continuous education in staff and leaders to help make decisions and influence the culture of healthcare with evidence-based practice. Distinct leadership principles. To be able to have a sustainable healthcare delivery, the healthcare system itself has to remain financially viable. This includes the use of materials and supplies, employee workloads and staffing based on patient volume, healthcare technology use and advancements, and meeting consumer needs. The financial outcomes of the organization should be measured in conjunction with the performance criteria of the organization. The F&P is able to provide perspective and practical application to make necessary financial decisions. It is important for the F&P to provide their perspective to help influence the financial needs of the organization. This is effective against leadership styles because they must provide leadership in their ability to help influence the budgeting and financial gains of the organization they work for. Being able to process ethical dilemmas is a necessary component of leadership skills, as they should not lead based on emotion or being under pressure. The ethical principles include autonomy, beneficence, justice, and non-maleficence. Autonomy includes allowing a patient do what they want with their body even if you disagree. Beneficence is doing what is best for the individual. Justice includes the leader upholding the legal, financial, cultural, and social norms. And lastly, non-maleficence include doing no harm to the patient. These all influence leadership by giving a framework for what is expected from the F&P leader to do their job with the best interest of the patient in mind, but also allowing them to refuse treatment if that is what they wish. Spiritual leadership involves trying to understand a person's internal drive. This means taking the time to connect with and understand why a person believes whatever they may believe in. This also means being supportive of spiritual beliefs and providing a care plan that is respective of those beliefs. As a leader, you should embrace cultural diversity to help support creativity and social justice of the community members you are taking care of as an individualized approach. Cultural beliefs can impact how a person receives healthcare and the decisions they make in their day-to-day life. My PICO question is as follows. In a primary care setting, how does creating rapport with schizophrenic patients allow the advanced practitioner to provide more effective care to the patient? The 4 principles of financial, ethical, spiritual, and cultural apply to my PICO question by giving supportive framework of how to approach schizophrenic patients, as well as knowing how to provide effective care to these patients. Understanding the 4 principles helps guide their financial status by knowing what hardships they may face, knowing their ethical status to understand their level of understanding, and their spiritual and cultural status to know how to approach them in a way their background will support their healthcare plan. Leadership journey. After working as an RN for the last 7 years, my leadership journey has changed drastically looking back. Previously, I was a timid nurse who was scared to speak up on behalf of my patients. I was always afraid of confrontation and people asking questions that I didn't know the answer to. I worked with a preceptor who instilled in me that to be a good nurse, you have to have a backbone and not be afraid to speak up. Over time, I have become someone who always provides constructive criticism and feedback to those who may need it, especially new grads that I now have to precept. I have transitioned to the role of not being afraid to step into the leadership role in codes or critical patients. Recently, I had a patient who was here for esophageal varices. She was projectile vomiting and was no longer protecting her own airway. I advocated for her to be intubated, but there were no ICU beds available to take her to. Endo refused to come to the ER bedside to perform an EGD that the patient needed in order to place bands to stop the bleeding. However, this patient was deteriorating quickly no matter how much blood I gave her. Eventually, I was able to speak to Endo and they came down to band the bleeding sites and help the patient eventually stabilize. The leadership style I presented in this situation was a directive style, as I did not put much consideration into the supportive aspect and more consideration in the aspect of that is what the patient needed, and I was not going to stop advocating until she got it. Types of feedback. There are 4 types of feedback. These 4 types are directive, contingency, attribution, and impact. Directive involves telling someone what to do. Contingency gives a future consequence. Attribution describes someone or their actions as a label, and impact informs the receiver about the effects of their actions and how they have impacted other people or the organization. Leadership feedback. For my leadership feedback, I asked one of my charge nurses. Her name is Aspen. She has been my charge nurse since I started in the ER as a new grad baby nurse. Aspen stated, Morgan is a patient advocate first and foremost. She functions with efficiency and large knowledge base to ensure standards and needs are being met. She is able to collaborate with the healthcare team with effective communication and utilization of experience to meet healthcare goals. She is hardworking. She can quickly triage a large number of patients at once to accurately prioritize the patient treatment and identify critical needs swiftly. She is an essential asset to our healthcare team. Importance of feedback. Feedback on leadership is crucial to help people understand the impact they have made, identify areas for improvement, and to foster growth within their team. As a leader, it is important for your job to know how to give how to give feedback, as it can help support colleagues and their success. Learning how to give feedback can be the difference between meaningless conversations and giving a constructive coaching conversation. Leadership goals. To improve my leadership style, I believe the biggest things I need to work on are confidence and personality traits, as well as anxiety. This is because I have a very strong personality, and sometimes before allowing people the chance to explain their side of understanding, I jump to conclusions and think they just don't understand what I'm trying to explain. I believe my confidence will get better after working as an NP and being in the actual role. As I become an FNP, I will have to step into that leadership role more often, which means that it will become more natural for me to be a leader in that way. Personally, knowing I'm a leader in any way gives me a type of anxiety that is hard to explain. I don't get anxious often, but knowing that people depend on me, it causes me to feel a lot of pressure. References.